Assalamu alaikum. Today we are going to discuss about hypertensive retinopathy. Introduction. Hypertensive retinopathy consists of a spectrum of retinal vascular changes that are pathologically related to both transient and persistent microvascular damage from elevated blood pressure. Eye is the only place in the body where the vessels can be directly observed. Etiology: renal status, persistent microalbuminuria, early and organ damage including retinopathy. Cardiac status, more common in concentric hypertrophy. Secondary hypertension, renal hypertension secondary to focal segmental sclerosis and membranoproliferative glomerulonephritis, severe retinopathy. Pheochromocytoma grade 3 or 4 retinopathy. Pathogenesis phases. There are three phases: vasoconstrictive, exudative, sclerotic, and its complications. Vasoconstrictive phase. Reversible stimulation of the vascular tone of muscular retinal arteries as an autoregulatory mechanism. Prolonged blood pressure elevation, definitive narrowing, angiotensin II, vasopressin of the vascular lumen at the precapillary level occurs. Vasoconstrictive phase, cotton wool spots, feature of inner retinal ischemia, interruption of axonal, orthograde, and retrograde energy dependent organelle, transport in the ganglion cell axons, swollen interrupted nerve. Exudative phase, vascular endothelial necrosis or disruption, disruption of the blood retinal barrier, transudation of plasma into the vessel wall around pericytes and arteriolar muscle cells. Retinal HGE of various shapes and locations. Edema and exudates the macular region. Sclerotic phase. Fibrinoid necrosis or hyaline degeneration, hyperplasia of the vascular tunica media, arteriosclerosis, narrowing of arteries, AV crossing abnormalities. Clinical features: chronic hypertensive retinopathy, hypertensive choroidopathy, hypertensive optic neuropathy. Retinopathy. Key features: narrowing and irregularities of retinal arteries, AV nicking, blood retinal hemorrhage, cotton wool spots. Arteriolar narrowing, ischemia. Vascular leakage, loss of endothelial cells or necrosis of muscle wall. Arteriosclerosis, hardening of the arteries, collagen deposition within the wall like onion skin, hypertrophy and hyperplasia of arteriolar smooth muscle, loss of vessel wall elasticity. Arteriosclerosis, Selous sign. Arteriolosclerosis, gun sign. Arteriolosclerosis, bonnet sign. Classification: Kate Wagner Barker classification. Group 1, mild to moderate narrowing or sclerosis of the arterioles. Group 2, moderate to marked narrowing of the arterioles, local and generalized narrowing of arterioles, exaggeration of the light reflex arteriovenous crossing changes. Group 3, retinal arteriolar narrowing and focal constriction, retinal edema, cotton wool patches, hemorrhage. Group 4, as for Group 3 plus papillary edema. Sky classification. Hypertension, grade 0, no changes. Grade 1, barely detectable arteriolar narrowing. Grade 2, obvious arteriolar narrowing with focal irregularities. Grade 3, grade 2 plus retinal hemorrhages or exudates. Grade 4, grade 3 plus papillary edema. Arteriolar sclerosis. Grade 0, normal. Grade 1, barely detectable light reflex changes. Grade 2, obvious increased light reflex changes. Grade 3, copper wire arterioles. Grade 4, silver wire arterioles. Arterial narrowing and straightening. Sclerosis may shorten or elongate retinal arterioles with the branches coming off at right angles. This changes in length deflects the vein at the common sheath and changes the course of the vein Salus sign. Extravascular retinal lesions, microaneurysm, retinal hemorrhages, streak hemorrhages located in the nerve fiber layer predominate over the blood hemorrhages located deeper in the outer plexiform layer. Cotton wool spots, retinal and macular edema. Retinal lipid deposits macular star is the most predominant appearance, and this appearance is due to the radially oriented nerve fiber layer of Henle. Grade 1. Grade 2. Grade 3. Grade 4. Association CRVO BRVO. Central retinal artery occlusion. Differential diagnosis. STN retinopathy, diabetic retinopathy. Hypertensive retinopathy, retinal venous obstruction. Hypertensive retinopathy, high altitudinal retinopathy. Hypertensive retinopathy, radiation retinopathy.